Okay, I forgot to mention, I'm going to be your moderator to the end of the day. So our second Fire Chat is going to be about actionable support models, examples of cooperation benefiting importing and exporting countries. Please join me to welcome Faisal Jilani. He's the Director for Africa, Asia, Latin America at the Middle East, Gavi, the Vaccine Alliance. Nice to have you. So welcome. And we would love to hear from you. There's a lot of mixed thoughts about vaccination and immunization. We know it has been a game changer in the healthcare sector. However, it comes with big challenges. How it comes from starting with policies, affordability, is it available in countries, in a global perspective. I know you have extensive experience in the field, so if you can just walk us through the immunization challenges and policies worldwide.
Thank you so much. Thank you for having me today. So the theme of this session is building strength together, and that's what Gavi is about. So the original name is Global Alliance for Vaccine and Immunization. It has been so popular as Gavi now, the Vaccine Alliance. It's a public-private partnership which was launched in 2000 at the World Economic Forum Davos. It was one of Bill Gates' idea and initial investment back in 2000 with the headquarters in Geneva. And initially, there was a vaccine, not hesitancy, but affordability challenge. Many countries, low and middle income countries could not afford the life-saving vaccines like of pneumococcal, diarrheal diseases, rotavirus, and so on. So the idea was not to reinvent a new wheel, but how to bring the existing players together and just kick off this whole vaccination drive and in order to save millions of lives around the world. So it's an alliance of 4 core partners: World Health Organization, UNICEF, WHO, UNICEF, World Bank, and the Gates Foundation, of course. But together with governments, both at the donor side and the implementing countries, civil society, research and technical institutes, pharma industry, and we have 9 independent on board. So together, this group of institutions and individuals which run this organization and have been successfully running for the last 25 years. So since inception, Gavi has immunized more than 1.2 billion children around the world and have saved more than 20.6 million lives precisely, and have economic benefits of 280 billion. What does it mean? It's called, immunization is one of the best kept secret and best investment. $1 spent in immunization is the return of investment is $54 if you look at the overall benefits and social and life save and hospitalized cost and so on. It's a John Hopkins study. So it's one of the best investment in public health. So how we operate, so as I said, the idea was not to reinvent the wheel. So Gavi is, we do not have presence in countries. So we started with 78 countries. Now we are down to 57 by the end of this year, and then 54 from next year. So the idea is that one of the best success for Gavi is how soon we become jobless. So the organization is shut down. So 19 countries have already transitioned out of Gavi support as we speak. So the idea is we support with health system strengthening, which includes the trained workforce, of course, building countries' capacity. We engage with ministries of finance, overall government operators, but largely Ministry of Health and Ministries of Finance. We try to include budget for immunization. Every country Gavi supports must co-finance, and then ultimately transition out of support when they have a strong economy, stronger systems, and so on. Be it Somalia or Indonesia or Pakistan or India, or every country must co-finance. There are waivers in terms of challenges, either man-made or natural disasters some countries sometimes face. So there are waivers, but still some donors have to pick up that waiver. So we keep that continuation of co-financing. So that's one of the unique model, if I may say, in terms of within the development space. So we basically, the first pillar of Gavi is we shape the vaccine market. You talked about affordability. So under Gavi, since 2001, we had 5 WHO pre-qualified vaccine manufacturers around the world. So very limited capacity. We had 78 countries to support. So under Gavi's market shaping initiative, as we speak, we have 19 manufacturers in 12 countries around the world. And if pentavalent vaccine 5-in-1 was about $5 25 years ago, it's 89 cents. So we pull demand from countries, we go to pharmaceutical companies, and we negotiate the price. So, for example, if I buy about 10 life-saving vaccines in US out of the shelf, it's $1,300 over 3.5 years period. But Gavi price is between 24 and 27, depending on where are we delivering and where are we buying from. So that gives a lot of value for money for donors to channel resources through Gavi, so we could reach more children or support more countries with less. So that's the one pillar. Second pillar, I briefly mentioned about engaging countries, working with them, co-financing, health system strengthening is something we really take things serious. And we need highly trained and motivated workforce. It's about saving lives. And vaccines, as we know, is given to healthy children or adults. So these are some of the key things. I'll stop here if you have any follow-up questions.
No, actually, I would love if you elaborate more. So you mentioned strengthening the health systems, and you mentioned specifically the healthcare workers. If you can just elaborate more about what initiatives have you done? How do you assess the readiness of whoever you are training to just pull out of the country and drop it, like as you mentioned, from down to 57 from 75 or so?
So we don't assess. So Gavi is very top-down, so bottom-up organization. So it's the countries who reach out to us. So what we do with limited resources, we come up with ceilings, financial grant ceiling for countries we support. So within that ceiling, they come up with their own prioritization. They have their own 5 years comprehensive program. So based on that program, they reach out to us for health system strengthening, right from training. With every vaccine, you need a specialized training. So if I'm trained for pneumococcal vaccine, I cannot administer automatically rotavirus vaccine and many others. So every vaccinator has to be trained for that specific vaccine. So then we talk about cold chain, supply chain. So vaccine cannot go itself. So we have to deliver from manufacturers to the capital to the last mile and until the arms and bodies of children and people. So we need the whole supply chain system around that. So we work with government. I mean, government reach out to Gavi with funding request, and based on that ceiling, we support them on where the needs are. So it's very bottom-up approach.
So when you say vaccinators, we typically think about physicians. So from your experience in different countries, how does having a multiple healthcare providers capable of giving vaccines, I mean nurses, pharmacists, and others, how would that make a difference from your experience in maybe going faster, having a higher vaccination rate or immunization rate?
So I think it's about the availability of vaccine and so first ensuring vaccine is available. So in number of countries, we had an example in my own country, Pakistan, where Punjab is the largest province with 110 million population, and suddenly there was a dramatic decrease in coverage. Children's immunization from 80s, it came down 88, 89. It came down to 65, 66%, and it was alarming. So governments conducted a study with the help of a local partner, and they figured out it's not about vaccine hesitancy, it's not about the supplies. It's about the vaccinators' behavior and ways of working. So with less than £1 million investment by British UK government or DFID back then, engaging a very high-tech small startup called Acasis, I'll be marketing for them, and they just monitored vaccinators. Of course, there were certain parameters between 8 and 4 p.m., so after that the system will automatically switch off. So for example, if they go to facility, they will press, let's say 1. So they know. Even the chief minister of province knew that I am at the facility at 8 o'clock. Then every child that the vaccinator would immunize was recorded immediately in a nanosecond. Even the whole government operators could see that. So with very little investment, Punjab increased in 11 months 21% increase in coverage, and we celebrated that in Geneva. And globally, it was 0.7%. So sometimes it's not about people don't know. They know, but they don't do. So, but coming back to earlier point, it's about how government identify the gaps. I mean, when any government introduces a vaccine, we have to make sure that the right readiness is there from cold chain, because every vaccine, again, has a different temperatures set up. And the trained workforce, the leadership is also trained on how to manage that. And more recently, we have, since 2016, we launched an initiative called Infuse, where it's innovation, uptake, and scale, and equity in immunization. So its idea is how do we bring some proven solution to fix some of the bottlenecks. For example, the vaccines cannot be stolen, so that's because it's usually it has to be provided for free. But there were losses. So we have a partner called NextLeaf, a very small company. So they have a gadget, $5. Now it's reduced to $2.5, I think, $2.5. So it's from manufacturer to the last mile, the temperature is monitored. And 5 officials are trained. They have it's on their gadget that they're immediately alerted if temperature goes up or goes down. So we are also bringing some of these technologies. So again, coming back to the workforce, which vaccine we are delivering, what are the needs, where are the gaps? So that's where Gavi will come in with our own alliance partners and other stakeholders in ground to equip countries or ministries of health to deliver that to the last mile. I think in an earlier session, a colleague mentioned about the zipline, and zipline is another model. Since 2016, we are working with them. We are delivering vaccines through drones in 5 countries in Africa. And in last 8 years, we have delivered 24 million doses, and which is surprisingly 42% cheaper than if we deliver vaccine manually to the last mile or closer to the communities. So so one of the beauty about Gavi is about flexibility and innovation. So from financial to the last mile delivery, it's quite an innovative organization.
That's great to hear. I just want to get into one of the bottlenecks you mentioned. So when we talk about capacity building, one of the things we need to think about is health worker development. Again, so the question is, what would be challenges from what you've seen in different countries, different governments, in developing the workforce to be vaccinators or even handling the vaccines? Like, for example, we talk about zipline. Who's going to be operating these? It's like an ecosystem that you have to make sure you have it and build it appropriately. So what are the biggest challenges? I would like to take the last 3 minutes to know the challenges so we can overcome in the future.
Yeah, I think the one big challenge is the workforce, availability of workforce, or sometimes we need more resources. Perhaps the trained workforce is not available. So that's one of the areas. The other challenge in vaccination space is increasing conflicts or other challenges countries are facing. So we have more in last few years, starting from COVID and now, we have access issue in number of in many communities. And I said it's not necessarily the availability of workforce, is identifying the right workforce and how we can train. So these are some of the challenges I would say perhaps in countries.